Hi, did you know that many publications today are using the term type 3 diabetes for dementia? And the reason they're using this term is really because they're finding this intimate relationship between chronic elevations of blood sugar, insulin resistance, really promoting the tau phosphorylation, amyloid plaques, and tangles that are leading to the pathophysiology of Alzheimer's disease. See, one of the things that's really important to know is that when people have chronic hyperglycemia, chronic high blood sugar disorders, typical sign being that they get really fatigued after meals and crave sugar all day, that these insulin surges really have an impact on the transport of glucose into the brain. And the brain itself has recently been discovered to have its own transport mechanism that is totally insulin dependent. They found that the GLU24 receptor is actually involved with the transport of glucose across the blood vessels into the brain. So what happens to many people is when they get this chronic hyperglycemia and insulin resistance throughout their body, they also have it happen at the brain. The brain really becomes insulin resistant, and they get stages of hypoglycemia where their brain doesn't have fuel, and they get depression and can't focus and can't concentrate and can't think. And then they get states where they get chronic inflammation. Insulin turns on inflammatory reactions in the brain. Insulin turns on different hormone signaling pathways that disrupt neurotransmitter activity. Insulin promotes vascular changes in the brain that leads to little microstrokes and ischemic changes in the brain. All these things start to shrink the brain and start significant degeneration in the brain. So one of the things that we're going to cover in the Kharrazian Institute course called Diabetes and Dysglycemia Clinical Strategy and Treatment Applications is show you all the research of how blood sugar disorders impact dementia, but more importantly, teach you how to identify early signs of dementia. If you're working with a diabetic population, you really have to understand this relationship, how to identify it, and you have to take extra interventions to really support the brain besides just stabilizing blood sugar levels. Now, these patients really have some very early signs when they start to develop this type 3 so-called diabetes, and their brain becomes inefficient in getting glucose across it. Number one, they'll have these constant episodes of just getting fatigued, depressed, not being able to use the brain that just come and go. It's really like a roller coaster ride of brain function. Number two, they'll just have constant brain fog. Well, actually, various degrees of brain fog, but some degree of brain fog all the time where they just can't get to their thoughts, they can't focus, they can't concentrate, and their symptoms definitely all get worse after they eat. And they get that huge insulin surge, they basically notice that their brain function is just not there. So the major red flag that a person has these mechanisms that are taking place of causing these inflammatory changes in the brain from insulin resistance, so-called type 3 diabetes, is just loss of brain function, focus, attention, concentration, motivation after a meal, and for some people it can last for a couple hours, 2 or 3 hours afterwards. So we'll be discussing all these in the upcoming course, and I hope you can join us. Thank you.